think it tells us a key piece of information about how it is that ischemia happens when we do these aesthetic injections. Now, we know that ischemia happens because of vascular occlusion. That's clear. But which vessels are occluded and where, that part we don't know. Some say, and this is the easier option to visualize, that it's a big plug of filler that travels down the artery through branches until it meets a branch where it can't pass through, and it plugs up that branch and obstructs blood flow to all the tissue that that branch supplies. This never made sense to me as a surgeon who's operated on the face quite a bit. We cut off arterial branches all the time when we operate in an effort to get to where we need to go, and we never get ischemia because the collateral circulation is so good on the face. What's always made much more sense to me, and this is the second model, is that when the filler gets into an artery, the sheer force of systolic blood pressure breaks up the filler into a million little pieces, and those go all the way downstream into the capillary bed. At the capillary bed is where you get the obstruction, and that's where you get ischemia. There's no collateral circulation at the capillary bed. I think that the success of leech treatment in this case of ischemia is strong evidence for that second model, because the leech acts locally. It's an anticoagulant that acts only where you put it. If there was a big plug further up in a branch, leech therapy wouldn't work. I think this informs how we treat ischemia and necrosis, and I think we should treat it in a targeted, specific way at the point of where the ischemia is happening, not further upstream trying to look for these big obstructions. This is, of course, preliminary evidence, but I'm excited about it, and when it gets published, I'll post it and you can read all about it here.